Good morning and welcome to the March 12th EMCC meeting. And we'll start with call to order introductions.
Good morning. We will do a roll call for attendance. Would help if I start with the right page. Will Hiller.
Here.
Chris Borkin. Sam Klemick.
Here.
Harry Robbins.
Here.
Jody Schaefer. Paul Wood.
Here.
Marie Lutz.
Here.
Spencer Harnett, who has resigned. Carla Spencer. John Anthony is not here today. He's unable to make it. So Cheryl Getz, you will be representing BLS Fire today. And all right, ex officio members, Teresa Rios.
Here.
Kelsey Scanlon. Leanne Migoski. Alternates, Mike Esslinger. Mike DeLeo. Dr. Hawthorne. Joe Cafaro. Bandy Smith. And then I'll let EMS agency staff introduce themselves.
Kimberly Hernandez, EMS Agency.
Karina Moreno, EMS Agency.
Blake Anderson, EMS Agency.
Deborah Hopgood, also with the EMS Agency.
All right, very good. Guests in attendance.
Stephen Christie, Salinas Fire.
Justin Reyes, Monterey County Regional Fire. Ben Hitchcock, AMRCES.
Dr. Bryce,
Salinas Valley State Prison.
Sorry, Michelle Kalinsky, Chomp.
Got Dr. Kalinsky.
Yes.
Was that you, Shane?
Shane Vanderbean, Salinas Fire.
Thank you.
Silas Fisher, Monterey Fire.
Thank you.
Dr. Bright, Salinas Valley State Prison. I don't know if I got stepped on.
Dr. Bright, thank you.
Susan Duke, Chomp, ED.
Thank you, Susan. It's everybody that I can see. Appreciate you all being here. All right. Very good.
Item 2, public comment. Any member of the public may address the committee for a period not to exceed 3 minutes on any issue not on the committee's agenda. The EMCC will listen to all communications but may not take action. No comment. We'll move on to item 3, approval of the past EMCC minutes for the January 8th meeting. Do we have a motion? Do we have a second? Second. All right. And a vote?
Would you like to do a roll call or just a voice vote?
I'll do a roll call.
Roll call vote. Will Hiller.
Aye.
Sam Klemick. Harry Robbins. Jody Schaefer. Paul Wood. Yes. Marie Lutz.
Yes.
Carla Spencer. And Cheryl Getz. Motion passes.
All right. Moving on to item 4, standing reports. EMS Director Teresa.
Thank you, Mayor Barrow.
Yes, ma'am.
Thank you. Thank you. My report is brief. First is the RFP was released at the end of January. We held the bidders conference February sometime. The conference was well attended. Right now, we're in the process of answering the questions that were received. Those have to, they need state approval before we can release them for the public, which we expect to be able to do that very soon. The second item, and I want to take a moment to thank Dr. Bright, who has joined us online. Dr. Burley and I had the opportunity to attend a meeting with the medical team at Salinas Valley State Prison. Dr. Bright was one of the individuals we met. The team was very welcoming. We had the opportunity to provide a presentation on an overview of the EMS system and of the role that the EMS agency plays within the system. Dr. Bright showed us, their facility. It was very informative. We are excited that he was able to join the meeting today. And I think that we are on the right track to develop a good working relationship. Hopefully, there will be opportunities where we can realize some efficiencies in the system, meet their needs and meet the system needs, and more than anything, the needs of the patient. Dr. Bright, would you like to say a few words or a little bit more about your background?
Thank you very much. Good morning. Yeah, my title is the Chief Physician Surgeon here at Salinas Valley State Prison, a maximum security prison that has lots of involvement with the EMS, as you all know, and we're very grateful for the team effort there. And we're anxious to work as a team. We got working on a program to keep and treat our overdoses that respond in Narcan here and not send them to the emergency room. And so hopefully we'll have that up and running in the next couple of weeks.
Okay, well, thank you. And if it's okay with the chair, I can go into the medical director report. Okay. Well, once again, Dr. Bright, thank you for attending. We really appreciate you showing us around the state prison facility and being so warm and welcoming in our reception during our recent meetings. So thank you for being here, and we look forward to a continued dialogue with yourself and the other staff at the state prison. So thank you so much. In terms of the medical director update, we met for the clinical care committee meeting earlier this morning. Just a few brief updates. Teresa had some updates which you've already heard from her. We also had a report from Blake regarding health data exchange, and he has a report for this committee later in the agenda, so I'll leave that to him. We had a good discussion regarding the 2025 policy protocol review cycle, where that's at. The clinical care committee voted to endorse the current 2025 policy protocol review cycle, which will now be moved on to implementation and training. We had a brief update from Deborah regarding CCC membership, and also an update from Blake regarding CQI tags. So those were the highlights from the CCC meeting. Happy to answer any questions.
All right, moving to MOAC, Deborah Hopgood.
All right, good morning, everybody. So another couple of busy months for the Mohawk program. We have been participating in planning efforts and the final planning meeting for the active attacker full-scale exercises that are taking place this week. One held in San Jose earlier this week and another one, I believe tomorrow, taking place in Santa Cruz. The organizers for that exercise mailed out invitations to any agencies to see who might be interested in participating. So that was open to all of the local agencies. We've also been attending healthcare coalition meetings and working on the planning meetings for the recent medical response surge exercise. So that was an opportunity to work with all of the hospitals, as well as AMR and our public health partners to test the ability of the EMS system to respond to, EMS and hospital system to respond to a surge of patients. So that went really well. There were some good learning points that came out of that. Public health has just published the AAR, so we'll be reviewing that and looking for any other additional learning points out of that. Otherwise, we have been working with some of the animal service providers locally to obtain PPE for the H5N1 response. So the state has made a cache of supplies available through the end of March for any people who might be working either in the cattle or dairy industry or caring for cats or other animals. So we've been working on that, and that's all I have. Happy to answer any questions if there are any, though.
Thank you, Deborah. Moving on to item 5, EMS system performance metrics. Kimberly, communication system testing.
Okay,
Good morning. I have the next 5 items, so I'm going to go through, pause for some questions after each one, so just bear with me. First, we have the 800 megahertz radio testing, which the report was included in your agenda packet. It was noted on the report that there was no testing in January, and there also was mostly no testing in February due to EMS dispatch had to move from the Schilling location back to County Communications Building due to a power outage here in this building. So it was difficult to move the 800 megahertz phones, so the testing was suspended. It was restarted on the 27th of February, so we'll have probably a full month of reporting for March at the next meeting. Any questions on 800 megahertz? Okay, moving on to ReadyNet. Pretty status quo, that was not suspended. There was a few days that there was some testing that wasn't done due to the moves and just kind of coordinating of things when EMS dispatch had to move back and forth. We continue to report this monthly to the hospitals so that they're aware of what their responses are and if there's any it's time of day and different shifts and things like that, so they know who is answering the ReadyNet drill or not. And any questions on ReadyNet? Okay. Moving on to contract compliance. Also, that's included in your agenda packet, so I'm going to go through it pretty quickly because it was, we're reporting on December and January, and essentially all reportable priorities were above or we're at or above 90% compliance for December and January. So that includes overall compliance, green response area, yellow response area, and orange. So compliance is doing really great. Want to commend AMR. I know they've had some posting changes. They've done some things to keep compliance at or above 90%. So good job on that. Any questions on compliance? Okay. So now we're going to go into the fire-based ambulance report. We do biannually, which you see on the agenda is March and September. So the fire-based ambulance report is reporting on the full year of 2024. I'm just going to go over the overall for Carmel Fire Ambulance and for Monterey County Regional Fire Ambulance. This was also included in your agenda packet. So for Carmel Fire Ambulance for 2024, they responded to 906 calls with an average 90th percentile time of 10 minutes and 58 seconds for approximately an average of 76 calls per month. Regarding Monterey County Regional Fire Ambulance in 2024, they responded to 1,201 calls with an average 90th percentile time of 17 minutes and 24 seconds for approximately 100 calls per month. And in the report, there's a breakdown of within their area. So it's overall within their area, outside of their area, et cetera. Any questions on the fire-based ambulance provider report? Okay. Moving on. So now we're going to go into South County Medical Response Biannual Review. We last reported this, I believe it was in September. It's kind of new to EMCC, and at that time when we first initially reported it, EMCC members had asked us to splice out the city of Soledad because the city of Soledad responses include the prison because both prisons, because the prison is within the city limits. So we changed it a little bit where it's the city excluding the prison and then the prison on its own. So just going over the methodology, the medical responses for the city of Gonzales, city of Soledad, the city of Greenfield, and the city of King are extracted from AMR's their First Watch online compliance utility for the second half of the year, so July through December. And the responses are sorted and counted as compliant or late and calculated using a straight percentage. Just a reminder that response time is not a requirement at the city level. The goal of this review is to ensure that no area or community of the county is underserved. Okay, next slide. Okay, so for the city of Gonzales, during that 6-month period, there were a total of 277 combined priority 1, 2, and 3 responses. So overall compliant responses was 96%, 4% being late. And then you see the breakdown of priority, and all of those were above 90%, which I think is really great, pointing out that the priority ones is very low call volume for that period of time. and they were at 93%. And I mean, most people know, an ambulance is stationed in Soledad, so Gonzales can be proved to be a little more difficult to get to within that priority 1 response time. So I think AMR is doing a really great job of, if they have an ambulance in Soledad, they're getting them out on time, and if they don't, that they're moving somebody down from Salinas to capture these calls in Gonzales, especially for the priority 1. Okay, next slide, please. So the city of Soledad, and this is excluding any prison responses, so at CTF or Salinas Valley State Prison, so this is just going to be within the city of Soledad, excluding those. There's a total of 688 combined priority 1, 2, and 3 responses. Overall percentage of compliant responses was 94%, 6% being late. And then if you're looking at the breakdown, again, over 90% for compliant in all 3 priorities. And if you could move on to the next slide, please. So this is going to be the prison responses. There was a total of 1,001 calls, combined priority 1, 2, and 3. As you see, just for the prisons, the call volume is larger than the actual city of Soledad if you're excluding the prison. So high call volume at the prison, which we are aware of. Overall, 94% compliant responses and 6% late. Priority 1, 2, and 3, if you see that, and I want you to a reminder that the low call volume, it's not statistically stable. So, I mean, it just takes 1 call for it to be late to drop it. And again, this is not a requirement at this low level at the smaller level, but 87% for priority 1, and then over 90% for priority 2 and 3 for compliant responses. And next slide, please. City of Greenfield, total of 589 combined priority 1, 2, and 3 responses. Overall compliant responses was 94%, with 6% being late. You'll see in priority 1, again, low call volume, but 86% were compliant. We do know, similar to Gonzales, the city of Greenfield is harder to serve because there is not an ambulance station there. They're either coming from Soledad or from King City. And because priority 1 has a shorter response time, it's going to be, I mean, it proves difficult even if you hit the road right as soon as you get that call to get there within that priority 1 response time. But given that it's not above 90%, but I do think that they're doing a great job of getting there. And the rest of the priority 2 and 3, the percentage looks great for Greenfield. Next slide, please. Okay, City of King, 398 combined priority 1, 2, and 3 responses, and overall 94% compliant and 6% were late. And priority 1, 2, and 3 were either at 90 or above. And does anyone have any questions on the South County medical responses? So we're going to keep bringing this. We're going to keep monitoring it, right? We go over this with the contract compliance working group, and we'll keep bringing it to EMCC on a biannual basis. And we're also looking at other areas to review, but which one is next, which is North County. Okay, can you bring up the North County PowerPoint, please? So North County is going to be an annual review. The medical responses for North County, you can go ahead and go to the second slide, Karina. The medical responses for North County are for the unincorporated communities of Aromas, Castroville, Las Lomas, Prunedale, Pajaro, Moss Landing, and Monte del Lago. And similar to, or exactly the same as the South County, we pull those from AMR's online compliance utility and then sort them as compliant or late. We're doing this on an annual basis because there's so many more communities in North County. The call volume is really small. So doing it as 6 months, it's just, you'll see there's just, it wouldn't make a lot of sense. So for Aromas, total of 103 combined priority 1, 2, and 3 responses for the total of 2024. Overall compliance was 94%, with 6% being late. And you see the priorities, there's only 20 calls in priority 1, but they still met or exceeded 90% compliance. Again, there is no compliance requirement at the community level, but we are looking at this to make sure no community is underserved. Castroville, there were 392. Castroville compliant responses was amazing. 99% were compliant. And that's a hard area to serve because there's not an ambulance station. So they're either usually coming from Prunedale, sometimes from Marina, I do know that because AMR changed their posting, that they're probably having a little bit easier time if they have to come from Marina, because now they have 12-hour units there instead of a 24. So they're a little bit quicker to get on the road and get to these calls. 100% for priority 2, 98% for priority 1, and 98% for priority 3. So really great in Castroville. Las Lomas is 112 combined priority 1, 2, and 3 responses, low call volume. Overall, 94% with 6% being late. Priority 1, 89%. Las Lomas is an area that is a traditionally difficult to serve area because they are either coming from Prunedale or they're asking for mutual aid from Santa Cruz County. And sometimes they can get an ambulance started from Santa Cruz County, and then Santa Cruz County has to pull their ambulance back because of their call volume. So sometimes a priority 1 can be a little difficult because of the response time. However, it's at 89% and there are only 27 calls. So I think that still is, they're showing they're doing a great job. Priority 2 is at 97% and priority 3 was at 90. Next slide. Prunedale, the highest call volume of North County, 1,189 calls. Overall, 97% were compliant and 3% were late. Priority 1, 2, and 3 were over 95% compliant responses. We know there's an ambulance in Prunedale, so they are able to capture all of those calls, almost all of those calls, but doing a great job in Prunedale. Pajaro, 254 combined priority 1, 2, and 3 responses. Overall, 96% compliant and 4% late. Priority 1, amazing, 100% were compliant. Priority 2, 96, and priority 3 dipped down. And the reason why this is going back to Santa Cruz County is sometimes when AMR requests mutual aid and a call gets downgraded, once the call gets downgraded, the Santa Cruz County supervisors will pull their ambulance back because it's a code 2 call. So then they have to start the ambulance from wherever they're coming from. And if it's a priority 3 call, they could technically get shifted to a higher priority call, but that's the purpose of priority dispatch, right? To send the ambulances to the higher priority calls first. Okay, and now Moss Landing, 83 responses, 94 overall, 94% compliant and 6% late, and priority 1, 2, and 3 were over 90% for that time period, which is 2024. Next slide. And then the very small community of Monte del Lago, 37 calls, and all of them were on time. So great. Any questions on North County? All right. I'm done. Thank you.
Thank you, Kim. Moving on to item 6, old business. I believe the EMS ordinance revisions on hold, and we'll go to Blake for health data exchange report.
There we go. Good morning, everyone. In your packet, you should have received a report on the HDE program. Biggest takeaways from the HDE program as of right now is we want to thank the Natividad IT staff and AMR for working together. One of the biggest hurdles we had with missing outcomes being provided to providers was at Natividad, there was a patient registration issue, whereas patients weren't properly registered, outcomes would not be sent out to the first responder agencies and the transport agencies. Since then, they've developed a workflow that it seems to be working fairly well, and we have some updated numbers that were put in the report on the number of outcomes that the percentage outcomes that are being made to transporting agencies. And right now, all hospitals that are actively participating in the HDE program are consistently over 95% of transport cases are receiving an outcome attached to the EPCR. So we're very thankful for that. When we are continuing to monitor Me Memorial at this time, they're still in the building process. They're getting towards the end of the testing phase, and we should hopefully be hearing back from their team within several weeks, giving us a go live date. But there's still a few tests to be done, and that is the summary of our HDE report as of right now. Does anyone have any questions? Hearing none, thank you very much.
Thank you, Blake. Moving on to item C, which I believe is a standing item.
That is correct. policy 3030 related to the transfer of EMD data.
Thank you, Chief. Moving on to item D, prison response report. Kimberly.
Just quick update. We're still working on the prison response report, which is kind of prison EMS system, how it impacts the EMS system. So the epidemiology intern is working with the epidemiologist. I'm hoping at the March meeting I have more substantial update on more timeline when this will be able to be brought to EMCC, but they are still working on it. It's just time consuming. Thank you.
Thank you, Kim. Moving on to new business, item A, 2025 EMCC appointment reappointments. Steve?
Oh, very good. Give me just a moment to share my screen. Okay, so you can see that it's time for us to prepare for the expiration of half of our membership. So this typically comes to this group in March as a reminder that it's time for, if your appointment is expiring at the end of June, that we need a letter of recommendation from your appointing body. If you are a member of the public that doesn't have an appointing body, we'd really just need you to acknowledge that you'd like to continue serving on EMCC. So the members and the positions that are expiring are the law enforcement position with Chris Borkin, the ambulance contractor with Will Hiller, ALS fire chiefs with Sam Klemick, parks for John Anthony, and our two serving citizen representatives, Jody Schaefer and Harry Robbins. So those positions are expiring. The positions that are alternates for those, Paul Tomasi, Mike Esslinger, Mike DeLeo, and Bandy Smith, also expire with the member. So if you're on that list, please get your recommending body to provide us with a recommendation for you to continue on the committee. Please do. We would like to have you. We enjoy having all of you here. For those who expire in 2026, you have nothing to do for this cycle. However, we do need the fire chiefs to recommend somebody because Jim Laneborg has retired and therefore his position is open. We are actively recruiting for citizen representatives. We've been reaching out to the hospitality group, and unfortunately, I have not heard back. We've got some other ideas of groups that could probably help us out as citizen reps, so we'll see. Spencer Harnett has withdrawn his position, so that's open, and when we've received a recommendation from the AMR paramedics, and we will hopefully bring that announcement as that moves through at the next meeting. But we also do need an alternate paramedic representative. We'll be working on that. With that, any questions? Anybody need to know what to do? We're starting with the recommendations, and then we'll get back to you once we move it through. We need, again, if your bio, if you want to update it, the Board of Supervisors will need that. And we'll get back to you with the oath of office and things that you need to sign once we get you through the board process. Any questions? Am I forgetting anything? I don't think so. Okay, thank you very much.
Right, thank you, Steve. And Deborah Hopgood with the agency annual report.
So the EMS agency began its work on our 2024 annual report back in January. So we have initial drafts of all of the sections of the annual report and are working on combining all of those sections and finalizing the draft of the report. Our goal is to bring that to the Board of Supervisors meeting in May that occurs during EMS week and do a presentation there. Our other goal is to bring it to this group in May for endorsement as well. We do plan to send it out a week or two in advance of the meeting to give you some additional time to review that prior to bringing it to the meeting and asking for endorsement. So just an update on timeline and progress on that, and happy to answer any questions on it if anybody has any. Right.
Thank you, Deborah. Moving to item C, EMCC annual report. Steve?
Oh, sorry, I hit the button, it didn't take. Did a SWOT analysis during that period. Of course, the ambulance RFP was getting started. And that was the report. So is there anything you'd like to add, highlight? That's ultimately what we're looking for.
Should committee members email you and you're gonna start putting together the report?
So email, again, things, if you're comfortable with the initial, like, but from Bertram boilerplate, or if you want to make some changes, let me know about that, Harry.
Can you send that out, all
Yes, we did send it electronically last week. I can get you a paper copy because I know you prefer that. Okay,
We can get it out of it.
we'll send it again.
So my thoughts are, first off, I'd like to regret at the end of the report and to keep that up. And to me, the highlights have been the success of the HD program, the implementation, and And I think also, it seems to me over the last couple of years, as we're looking at AMR response times, consistently meeting or exceeding in those areas, which has improved over the years.
I think I would add that the looks that we take at North County, South County, and prisons, and then the general overall emphasis to avoid underserved areas.
Oh.
Otherwise, I don't think anyone can hear you online.
I'm sorry. Go ahead.
Go ahead, you said it all.
Oh, okay. No, I think that we need to look at, I mentioned our looks at the South County, North County, the prisons, and the general emphasis on trying to identify underserved areas throughout the county, period.
I would say the other highlight is the connection we've made with the prisons. I think that's a first that should be called out.
Amen.
I don't know if part of budget process, EMS agencies builds into their budget metrics and goals and objectives, but for this report, I think it would be good to have a short, sort of a bulleted list of goals and objectives for the coming year.
The annual report always identifies those.
Okay.
So are you looking for EMCC goals and objectives or a summary of the EMS agency's report?
No, for this report, this is EMCC's report.
Okay.
So anything, again, not looking for an extensive goals and objectives, detailed, but just some bullets. If there's anything, ongoing projects that are carryover projects that need to be finished, my thought behind it is just to have a goalpost for some of the work and some of the things that we're doing to make sure that we stay focused on things that we put our mind to.
Okay, thank you.
Draft, report,
Yes, you will see a draft. I'll try not to overdo, because again, I'm putting this in with all the other work, but what we will do is, as it's developed in the draft, we will send it out to everybody in advance of the May meeting, because ideally we can have this wrapped up in at least definitely the concept, but as much as possible, the actual product, so you can endorse what's going to go forward to the Board of Supervisors in July. And since we have to put it into the board's process, we can do some things at the July EMCC meeting, but it'd be much better to have this wrapped up by May. So that's our intent, to have this back to you mid-April, reviewed, and then we'll have it part of the packet for the May meeting, so that you can endorse or make any additional adjustments. Okay, well, thank you very much for the recommendations, and we'll start putting together the report and have that for you in about 30 days or so. Thank you.
Thank you, Steve. Moving on to announcements for the good of the order. Any member of the committee may make an announcement or comments. The EMCC may not discuss or take any action on any item raised during announcements, except to decide whether to place the matter on a subsequent agenda.
I'm going to defer over to Chief Christie here. St. Louis Fire's had a run of, let's call it good luck, but some good paramedicine lately I wanted to call out.
Thank you. Like the chief said, we had a very strong run in February where we actually had or documented 5 credible field saves. With that said, 2 of our probationary firefighters were in the process of completing their 10-call accreditation, which they've completed. So they're now working for us as paramedics. The 2 of them came from AMR or had previous experience. And within the first week, one of them had 3 field saves alone. One of them was a 28-year-old patient that actually was discharged the next day. So he's at home recovering. So, working as a whole, working with the team of EMS, the hospitals, transport providers, our fire-based ALS system, it's showing. And it was the field saves that we did record, they were true field saves where they actually moved to either the ICU or were discharged. So we're not just getting pulses back, but we're actually getting patients and lives back. So very proud to share that with you.
And just from the fire service, from the Fire Chiefs Association, I did send out via the email blast to the chiefs, but we're having a change in our annual Fire Chiefs recognition ceremony that's been traditionally a luncheon. We're having an evening event at Bayonet and Black Horse, and we're combining that into a hybrid event that's more of just a celebration of the fire service in Monterey County, honoring retirements, promotions, and of course, our 3 annual awardees. So I pushed that out. Feel free. Tickets are still available, May 29th, 6 o'clock. Thank you.
All right. Seeing there's no other announcements, so next meeting is scheduled for Wednesday, May 14th at 10:30 a.m. And do we need a motion to adjourn? No, you can just adjourn. All right. Thank you all for your time.